On to the next topic, a remarkable new study on the use of hallucinogenic drugs in medicine. Published this week in the Journal of Psychopharmacology, it looked at the impact of the mind-altering compound psilocybin on cancer patients dealing with anxiety and depression. Psilocybin is found in what is commonly known as psychedelic mushrooms or magic mushrooms. Jon took a look.
After Dinah Bazer was treated for ovarian cancer in 2010, the next 2 years were filled with dread.
All I thought about was the cancer, that it would come back and I would die of it.
How severe was the anxiety? Were you able to go on with your life?
I felt like it was destroying my life. Yeah, I mean, sometimes...
In 2012, Bazer entered a study to treat anxiety and depression in cancer patients using the hallucinogenic drug psilocybin, the active ingredient in certain mushrooms. Dr. Stephen Ross directs addiction studies at NYU Langone Medical Center and led the study.
The idea was that drugs which were known to induce spiritual or these unusual mystical states of consciousness might help people who are having this domain of distress.
Bazer took the medication in this treatment room with therapists present for support. During this session, she saw her fear inside her body.
And as soon as I visualized the fear, I became furious. In my mind, I screamed, "Who the hell do you think you are? I won't be eaten alive." From that moment, the fear was gone.
You took control.
I took control, and it was gone.
The NYU study and a second one at Johns Hopkins followed a total of 80 patients for 6 months after a single dose of psilocybin. There was lasting reduction of anxiety and depression in 60 to 80% of the patients.
I began to feel the most amazing love I have ever felt. I think my brain was rewired a little bit, and that love that I felt has done very well, very, very good things for me.
Jon, that is fascinating stuff. This seems to be a huge burgeoning field of research.
Yes, and you know, there are so many drugs that were banned as part of the war on drugs. So now we're seeing research into the use of marijuana for various conditions. The FDA just approved ecstasy, a trial to look for PTSD, and now we have the use of psilocybin. And it's good that we're going to have careful studies. For years, we've had our arms handcuffed behind our back, and people said, okay, you know, let's do some research. Well, now our arms are in front. We can do the careful research, and these have risks and benefits. Let's see in controlled trials whether they're useful and how they're useful.
And it's not just easing the mental suffering, but we know how important your mindset is to treating the physical aspects of diseases. So being able to offer patients another option, really, really great.
And just talking to Dinah, I mean, how remarkable.
Yeah,
Look at her
stories are incredible.
So emotional.
You can see it in her face. It's great. All right, Drs. Jon LaPook and Narula, thank you both.